Welcome to the DoubleACS Daily News. As kids go back to school for the 2021-2022 academic year, some parents are concerned about the state of COVID-19 and how that might affect children. Sturdy Memorial Hospital's Dr. Brian Patel spoke to us about the state of COVID in the area.
Hi, my name is Brian Patel. I am the Chief of Emergency Services at Sturdy Memorial Hospital and the Associate Chief Quality Officer, and have been overseeing the COVID response for the hospital for the past 18 to 20 months. Given the number of people in that age group that are unvaccinated, mostly because they're not eligible for vaccination yet, so anyone under the age of 12 right now is not eligible to be vaccinated because it hasn't been approved, I think wearing masks is going to be a very important thing for children as they go back to school. They're going into settings that are going to be much more crowded than they used to be as the social distancing requirements were removed, and so that risk of spread of COVID is going to become much higher while they're at school, and so wearing masks will be one of the big things to help reduce that spread. And we've clearly shown over the last 18 to 20 months that masking really does reduce the spread of COVID-19. And the more you wear masks in crowded settings and indoor settings, the more you can reduce the spread of that disease. And while children can get only mild disease of COVID, we have seen children get severe COVID and get very sick from it. And more importantly, they can spread that to other people who potentially can get very sick from it. And so the more we can do to reduce them getting infected, the more we can reduce the spread of COVID. So no vaccine is approved by the FDA without going through a rigorous data analysis. And so that's why there's been delays in getting the vaccine approved for the younger population, because they're still completing the studies and getting the data and collecting the data on that. And then the FDA reviews that data to make sure that the vaccine is proven to be safe in a large enough population of people that they feel it can be released to the public to get vaccinated. And so we're still waiting for all of that data to be evaluated and released before the full approval. And that's why it's been delayed further, hopefully by late fall. But I think that still remains to be seen as to when exactly it will be approved. And I think like any other medication that's being administered to a child, you need to look at what the side effect profile is of the vaccine when it gets released. The FDA wouldn't approve something if they didn't believe it was safe based on the data. I think that we've shown through the billions of doses that have been administered to everybody throughout the world that this vaccine is very safe, and the vaccine that would be approved for the younger children is the same exact vaccine that we're currently administering to everybody, and it's been proven to be very safe in the 12 to 18 population with very minimal side effects and very good efficacy, and I expect that to be the same for the younger population as well. The Delta variant is essentially now the most common variant that's causing COVID-19 throughout the United States, and that's no different here in Massachusetts. And so the majority of people that are contracting COVID-19 at this point are likely contracting the Delta variant. And so we're seeing it across all age groups. We are definitely seeing it higher in the younger population and the unvaccinated population. So we're seeing less of it in the older population, mostly because the majority of that population has been vaccinated. And so, we're tending to see it more in the middle-aged population and somewhat in the younger population. The vast majority of cases of severe COVID-19, so patients that end up hospitalized very sick with COVID-19 in the intensive care units or dying from COVID-19, are unvaccinated. So as an example, right now we have 5 patients in our intensive care unit who are all very sick with COVID-19, 3 of which are on ventilators, and all 5 of them are unvaccinated. We are seeing some vaccinated people get COVID-19, and that's to be expected, and where some of them are getting hospitalized, but their severity of illness is much less than those that are unvaccinated, and they're much less likely to be hospitalized and to die from COVID-19.